Thanks for joining me for this session of Discussions in Body Art. Just a couple notes to start this session. First, I've got some surveys, one for body artists and one for regulators as of now. They're not on Patreon, they're on my studio's website, newflowerstudio.com. If you wouldn't mind filling one of those out, they only take a few minutes. Just open the menu and click the Body Piercing Reporting Survey link. Again, that's newflowerstudio.com. Second, in this session, Perspective, I discuss the use of surgical environments as a baseline for body art sterilization information. If you enjoy this content, I'm simultaneously working on a supplemental session titled Difference. I think you'll enjoy that too. At the time this session was prepared, I had recently toured the sterile processing departments, or SPDs, of two large hospitals, one in the Midwest and one in California. I'm fortunate to have a few connections in that field who extended me those opportunities. Also, I'm a member of the Healthcare Sterile Processing Association, HSPA, which is a member-based organization that provides sterilization education and guidance for professionals in that field. HSPA hosts a large educational conference each year, and I recently treated myself to a 4-day trip to Las Vegas to see what I could take away for body artists. I've titled this session Perspective because I want to share what I experienced between my 2 SPD tours and also that conference where no one knew I was a body piercer unless I told them. In body art, we take a lot of information and concepts from healthcare and apply them to our field. This makes sense because so many of the risks in the medical field are also risks for body artists and their clients, so existing solutions from the medical field are relevant. The difference is scale. If you've been around long enough, you might remember when tattoo and piercing studios advertised their hospital, I say that in air quotes, sterilization as a marketing tool, appealing to clients who may be concerned about health risks. The use of the term hospital sterilization was rationalized by the mere presence of a tabletop autoclave and maybe ultrasonic cleaner. But having 1 or 2 pieces of equipment doesn't equal a hospital's actual sterilization program. It does, however, resemble a small medical clinic or dental office. This leads me to this session's title, Perspective. What we often overlook or choose to ignore is the difference in scale between a hospital's sterile processing department, surgical procedures, and body art facilities and procedures. The gravity and complexity of the surgical procedures performed in a hospital or other surgical center are significantly greater than a small clinic, dental office, or body art facility. Consequently, the measures taken to decontaminate and sterilize reusable instruments in healthcare is relevant to the degree of contamination and specifics of their instruments. When body artists must use specialized tools to disassemble their multi-part instruments and use additional specialized devices and products to remove muscle, fat, and bone from their tools, my perspective will be that body artists should be required to use the same processes as their SPD counterparts. Currently, I'm not aware of this level of contamination on any piercing or tattoo instruments. Body art instruments are much simpler, and the level of contamination is extraordinarily low compared to their surgical counterparts. Here's some perspective. I'm going back several years. Way more than a decade, I'm sure. Piercers were shifting into a direction of abandoning their reusable metal instruments, with reasons like piercings heal faster, but without offering evidence of that claim, at least not that I ever saw. It seemed like just an assumption we were all supposed to accept. That happens a lot in body art. I had a conversation at that time with someone who worked in surgery. I don't remember who, maybe it was a client. But I remember them clearly saying surgeons loved their instruments and would never abandon them because they make their job easier, more efficient, and safer, and they always want more instruments, not less. In that example is a rare moment of piercers not aligning their practices with surgeons. When I attended the Healthcare Sterile Processing Association's educational conference, I met many sterile processing professionals whose experience is with sophisticated surgical instruments dirty with a tremendous amount of blood and tissues. I've been decontaminating and sterilizing piercing instruments since 1998. Also, I worked in a small dentist's office in 1997 where I also processed dental tools. Not too many people I met at the HSPA conference had as many years reprocessing as I do, but what they did have is a lot more work with a lot more risk and responsibility. From their perspectives, the many times I described body art sterilization practices and answered the questions they asked me out of curiosity and sometimes fascination was that body artists go beyond what's necessary for their level of contamination. This is the halfway point of this episode, and I appreciate you listening. To hear the rest, please subscribe to the Discussions in Body Art podcast on Patreon. This has been the Discussions in Body Art podcast. Thanks for listening. If you enjoy my content, you can help me by suggesting this podcast to your colleagues. Subscribe on Patreon for exclusive content and visit newflowerstudio.com/NFW/podcast to learn more.